50% of dogs and cats over 4 years of age have signs of dental disease. Caring for your teeth and gums should always be part of your daily routine. This goes for our furry family members as well. Pets can develop the same periodontal disease, tooth decay, fractured teeth, and oral cancers as humans do. With proper treatment, a healthy mouth can be maintained. At Dove Valley Animal Hospital, we take pride in the high-quality dental services and treatments that we offer. All dental procedures at our animal hospital include pre-anesthetic blood work, an intravenous catheter, intravenous fluids, a pain management package, full mouth x-rays, a comprehensive examination, scaling, and polishing of the patient's teeth. Let us take you through a typical routine dental cleaning at Dove Valley Animal Hospital. During the scheduled admission time on the day of the procedure, our staff and veterinarians will perform a pre-anesthetic exam, discuss a treatment plan for your pet, and complete any release forms. The next step will be pre-anesthetic blood tests. Pre-anesthetic blood tests prior to surgery give us a look at the kidney and liver functions, blood glucose levels, protein levels, and red blood cell counts. This gives us more information about how your pet's organs are functioning on the inside. Once these laboratory results are available, our veterinarians and staff will utilize the physical exam findings and the laboratory results to formulate an anesthetic plan for your pet. Because of all of this information and attention to detail, we are better able to identify potential complications and reduce many of the anesthetic risks prior to anesthetizing your pet. Next, pre-anesthetic sedatives are administered to reduce stress and increase your pet's comfort level. This sedation will also decrease the need for more potent anesthetic drugs and therefore reduce anesthetic risk even further. Following sedation, an intravenous catheter will be placed. The catheter site is first shaved and scrubbed. The intravenous catheter will be placed and a bandage will help hold it in place. Having an intravenous catheter provides us with immediate access to the vein. This catheter will decrease our response time to any changes or complications that could arise during anesthesia and therefore reduces anesthetic risk. To minimize potential complications even further, intravenous fluids are administered through the catheter. This fluid administration helps us maintain and regulate your pet's blood pressure during the anesthetic procedure. These fluids also help keep your pet hydrated and helps them recover from anesthesia more quickly and comfortably. These fluids reduce anesthetic risk even further. Now it is time for anesthetic induction. Anesthetic drugs are administered through the IV catheter. An endotracheal tube is placed into the trachea to maintain an open airway. The tube is connected to an anesthetic machine to allow for the administration of oxygen and the anesthetic gases that will be used for anesthesia maintenance during the procedure. Using anesthetic gas allows us to adjust the depth of anesthesia quickly and efficiently, reducing the anesthetic risk compared to intravenous anesthetic medications. Anesthetic monitoring devices are connected to the pet at this time. Typical monitoring may include tracking temperature, pulse, respiration, blood pressure, EKG, oxygen saturation, and carbon dioxide saturation levels. Pre-cleaning photographs are taken for our records. Similar to many cases of human dental cleaning, we use an ultrasonic scaling instrument to remove the tartar and plaque from your pet's teeth. It sprays a cooling mist of water to wash off debris and keep the tooth at a normal temperature during this procedure. Some hand scaling is done as well. After the scaling is complete, we follow with a fluoride paste to polish and smooth away any remaining microgrooves that may be present. Dental radiographs are taken to show us what we cannot see on oral examination. Up to 60% of real dental disease may be located below the gum line. X-rays allow us to examine the tooth root and the bone that anchors it. Sometimes X-rays are the only way to see an abscessed tooth, bone loss, cancer, or other disease processes. All gum pockets are probed and measured with a special instrument. These measurements are documented for our records and any future treatment recommendations. After the scaling, radiographs and probing are completed and recorded, and a complete review of the findings is performed. Problem areas that may require additional or specialized treatments are identified and a supplementary treatment plan is formulated. The pet owner may be called at this time to discuss these additional recommended treatments, including extractions, bonded sealants, antibiotic wax, root planing, biopsies, and their associated expenses. If additional procedures are approved, they are completed at this time. Once the dental cleaning is complete, your pet will continue to be monitored during anesthetic recovery and for several hours afterward until their release from our hospital that same afternoon. Every pet recovers from anesthesia at their own pace, and owners can expect mild sleepiness for approximately 24 hours after the dental cleaning. In most instances, your pet's breath will be immediately improved following their teeth cleaning. Thank you for taking the time to learn about your pet's dental health. Please let us know how to better serve you or answer any questions you may have. Call or email for an appointment today.